So, welcome to Dr. Z PhD interviews. This is a place where I interview people I find both interesting or inspiring. And today's guest, we have Eryn Gitelis. Is that Gitelis? How do you pronounce your last name?
Gitelis.
Gitelis, okay. And Gitelis.
Yeah.
Gitelis. Okay, is it Italian?
No, it's a mix. I think I'm mostly Austrian, Polish, mixture of things.
So quite eclectic.
But I'm not.
Okay, so quite eclectic last name, right? So Eryn is actually a founder of Pride Speech Therapy. She's a licensed voice and speech therapist, and she works with primarily you work with transgender people, right?
Mm-hmm.
Right.
Yeah.
Okay. So Eryn, welcome to the show. Tell me a little bit about yourself. Tell me where you come from. Tell me how you got into this line of work.
Sure. So I'm Eryn Gitelis. My pronouns are she, her. I'm originally from Chicago. I've been out in LA, I think about a total of maybe 13 years. I went to school at the University of Iowa, and then I moved out here, did whatever for 5 years, and then went back to grad school at the University of Central Florida. And I got into this line of work, honestly, because before I moved to Florida for grad school, I lived in West Hollywood. And so most of my friends were part of the LGBTQIA+ community, and I'd be out a lot in West Hollywood. And so I would see transgender individuals out and about. And so pan forward going to grad school, there were 2 slides in my voice class related to transgender voice. And I was so interested when I saw those slides that I had all these questions, and so many of them couldn't be answered. And I was fortunate enough to take a research class with one of the instructors that did a very early research study on transgender individuals in terms of pitch perception, Dr. Ratuznik. And so I did a mock research paper on that, which got me even more interested. And there was just such a lack of information. I thought it would be so cool to work with people and help with confidence. And it just seemed like a really different area. So
interesting. So when we talk about voice therapy, is there actually a difference between voice therapy training that you would do for somebody who is, for example, transgender versus somebody who is maybe cisgender? Is there actually a technical difference in that?
Well, it depends what the target is. So for affirming voice, gender affirming voice, there we're targeting modification. So we're still using a lot of the same therapeutic techniques we would use with somebody that has a pathology, nodules, polyps, that we need to reduce inflammation. So we're still using a lot of, it's called semi-occluded vocal tract exercises, which are doing exercises through a smaller space like a straw or styrofoam cup. And a lot of these exercises we've found over the years helps with resonance, the resonant voice therapy exercises. So when you pair that with modifying the voice, we do a lot of that with gender affirming voice modification as well. And it's also really good because then it's a safer way to modify a voice, or if somebody's tired, we do rely on those therapeutic exercises to relax the voice.
Interesting. So by now you probably work with a lot of transgender individuals. What would you say from your experience, majority has been primarily trans women seeking to feminize their voice? Has it been primarily trans men seeking to masculinize? Or has it also been non-binary people who may be seeking to kind of have a more gender neutral type of voice?
So 98%, I would say, of my clients are females wanting to feminize their voice. I've had a couple of male clients and non-binary clients as well. So that's always fun and different. But yeah, the majority are feminization clients, because as we know, testosterone, a lot of the times will lower the voice an octave, and therefore some people need some help with resonance, but sometimes testosterone doesn't give the individual the desired effect they want. And so then we do work with the pitch lowering as well as resonance and behavioral changes.
Yeah, I think sometimes people don't realize there is also masculinizing voice training as well as non-binary voice training. And I agree with you, testosterone is very powerful. And for a lot of people, it will do just that. It will lower their voice. But for a lot of other people, sometimes it does not. And I think people are not really aware. I think in the trans field, at least, I find it that we're so predisposed thinking about voice therapy as for women only. We're not really necessarily thinking about it for a lot of other people. Now, and I don't know if you may have an answer to this question, but for somebody who is looking to masculinize their voice, or for somebody who is going on testosterone and potentially is hoping they will experience that voice drop, if that individual is already, let's say, a singer, how will that, do you have any idea how that may affect their voice, their range, all of that?
So with the testosterone, if it does affect their voice and slows down their vocal folds and it adds mass to the vocal folds, they will get a deeper sound to their voice. And it may be harder for them to reach those higher ranges that they were once able to hit. But then again, you know, maybe with some therapy and training, they can still hit those higher tones that they were once able to hit. The great thing about singers, and I love working with singers, is they have such good breath support, which is just the foundation to voice, right? We need to be able to sustain these new behaviors, pitches, resonance changes, and maintain them throughout the day without getting exhausted. So singers are able to do that pretty quickly. But in terms of the lowering the voice and the pitch changes, yeah, usually the singer will then have a deeper sound. But again, sometimes testosterone doesn't do that effect.
Okay. I bet people coming to you for voice modification are probably terrified. I know that clients I work with all avoid voice training. My number one recommendation to anybody who is seeking transition is to immediately start with voice training if you're interested in modifying your voice. Obviously, if passability is a key for some people, I know it's not for everybody. So, but as the voice gives you a lot of dysphoria and discomfort, I always recommend to start immediately because I know that it can be a very long process for some people. And I made a video about this where there's this psychological shift that happens where it almost becomes an autopilot, right? Versus you being so hyper aware. Right. And the biggest fear, it varies from people to people. In your personal experience, when people come to you, what do you think is their biggest number one fear of starting voice training?
Oh goodness. I think the biggest fear is, do you think I would honestly be able to achieve my goal? I think that's the biggest one. And I think there's a fear of meeting me and just, you know, some insecurities there. And are they going to like the change in sound? Are they going to feel like themselves when we go through the process? And I think it's really important for people to know in the beginning, you're definitely not. In the beginning, it's very foundational. We're just learning these new behaviors. We're going up a little bit. We're using bigger intonation patterns. We're really changing that resonance, raising the larynx, playing with the tongue, the lips, the back of the throat, to overly modify so that when you get into conversation, you can relax a little bit. So in the beginning, it feels very sing-songy. And a lot of people will say they feel like an imposter in their own body or their own voice.
Yes.
And I understand that. And so my goal always right away, day one or in the consult or, you know, pretty early on is to have that individual hear their voice either in a word or a phrase and be like, I don't hate it. And you're like, cool, okay. So that's the buy-in there. And then that's the motivation for that client where I can then say like, well, then there's the goal. We can make everything sound like that and probably better because it's day two, you know? And that takes away a little bit of the fear. I like to be really friendly, have a lot of fun in sessions. I think that makes it a little easier too. I think as a newer clinician, I was very like, okay, here we are. We got to do voice. I got to be a professional. And then I found that the most important part is just building up somebody's self-concept and making them believe themselves and love themselves. And when you see somebody get even just a little bit more confident, you can see the relaxation and that voice comes really quick. Because the changes we're making aren't as huge as people think. You're not going all that much more high. You're not, you know, shifting a lot of things. Any little shift that you make, larynx raise, lips spreading, tongue movement is going to change your resonance. So, because that's just changing the shape of the cavity and adding a little bit of movement. Everybody's done it before. So I think once people are like, oh, it's not that. It's difficult because you have to think about it and it's new and you've been doing something a certain way for so long. But the most difficult part of voice therapy or voice modification is learning how to just be happy with yourself. And that's what that psychological piece is so huge in it, if not the most important part.
Right. So and I totally understand when people starting voice training, they sound the way they sound when they start off clearly is nowhere where they end up. And I've seen that before many times. And I know that practice is very important component of that. And that's what tends to throw people off, is that they go home and then they practice. A lot of times they record themselves and then they hear it back. And like you said, the imposter syndrome, right? Where they feel that they're faking it, where they feel like they sound like they're trying very hard to sound like a woman. What advice do you have for that period of time of training when people feel such a big sense of insecurity and oftentimes just end up stopping training altogether just because of that?
Yeah, and that happens a lot. And the biggest thing I would say is be kind to yourself. Give yourself time. It takes 2 months to 2 years sometimes to get this down to where you don't really have to think about it as much, right? Or to get it into your subconscious mind. And the biggest thing I also tell people is when you're listening to your recordings, because I record every session, is listen to what you like. Focus on what you like so that we can grow that versus focusing and going down this spiral of negativity of being like, oh, that dropped, or oh, that's low, or oh, that's deep, or whatever you don't like, ignore it and focus on those little bits. If there's one little teeny tiny thing that you like, you play it over and over and over again, because that's what we want to build. We don't need to focus on the negative stuff. It's voice, it's fluid, it changes all the time, and the other thing, in the beginning too, when a client will have a great session or even in conversation, they're just on point, and then they go out and get misgender, and it's so awful, for that individual because they feel defeated. And that's another big thing where you just have to be kind with yourself and know that this is a process and you're getting there. And that's great feedback from society. As much as it hurts, we can use that to be like, okay, what happened? It was a moment, and now we can change all the next moments. It's okay. Right. So that's where the self-concept piece comes in, just learning how to love themselves. I mean, we talk a lot about manifestation and just affirming self-love, self-care, because if you have that piece, the rest comes easily.
Yeah, I can imagine it's probably very challenging for people, right? Because they already struggle so much with confidence, they struggle so much with imposter syndrome, they struggle so much with gender dysphoria that is causing all of the things. They're very disconnected from themselves. So being kind to themselves is probably a lot challenging for a lot of people. So I can see how this is probably the biggest, which just says then this period of training, the beginning stages, where people just feel so insecure and just hate how they're sounding initially, is the most important hump to get over?
Yes.
Okay.
Good. And then there's the second hump, I want to say, of when they feel good and they feel confident and things are going well and they're going out and about and living their lives as, their true selves. And then they have a fallback or a bad day or a bad week or something emotional happens, which causes a change in your voice for sure. Or that misgendering happens, then it is kind of starting over again, but it's quicker because we've already proven you could get there. So you already have that buy-in a little bit, but that sometimes people will be like, I need to talk to you. Like I'm having a really bad week. Like I was doing really well. And then now I'm doing bad, where I'm like, there is no bad. It's a voice. It changes, today, tomorrow, it's going to keep changing. When I'm tired or sick, it goes down. It doesn't sound good, but it changes. But that was just a moment and it's over now.
Right.
It's okay. It's okay to have those moments. And I'm really open to where I'm like, send me a text, send me a message, send me a recording throughout the week. So you don't have to wait a full week to get this off, off your chest that you're feeling this way. Let's fix it. But yeah, that beginning, the buy-in, I call it, the hearing that one thing that you're like, okay, maybe it will work for me too. Because so many people are like, okay, but I have this and this and this and this. You're fine.
So it's about believing. So it's about believing and holding on to that belief that really helps you very much so. And talking about that belief, have you ever seen a person, or do you, maybe not even without seeing, do you think it's actually exists out there as a possibility that a person just absolutely cannot modify their voice with voice training? Is there such a thing as your voice is so incredibly masculine, there's just absolutely no way it ever can be modified?
It can definitely always be modified. Can you always achieve your goal? If there are any sort of pathologies there, it might add a big barrier, but for any healthy voice, it doesn't matter how deep it is. This is all muscle memory and using your muscles in a new, different way. And then a lot of it's behavioral. A lot of it is intonation patterns, fluency, elongating the vowels. So I have not yet seen anybody that has come to me and with a healthy voice that can't eventually get there. Now, some people do take longer. Sometimes there are barriers that I have to learn about too as we go along. You know, the longer I've been doing this, the more barriers I've seen, the better I get. But, you know, that I have to like learn too. Okay, what's happening here? We're going to figure this out.
Right.
You know, but if you have a healthy voice, you can modify your voice.
Okay. And you say a lot about muscle memory. My question is this: if somebody starts voice training and let's say he's invested 2, 3, 4, 5 months, and then something happened and they dropped out of voice training and resumed using their previous voice for a while, when they come back to voice training, is all of the time wasted? And do they have to start? No, so it's not like setting a reset button.
No.
You do have that knowledge. You do have maybe some things are going to be needed to be a little bit more polished up, but that practice right there stays, right?
That's in your brain. So it's like relearning anything. It's like, I don't even want to say it's like going to the gym, getting out of shape and back into shape again. Cause I don't think it's that difficult. Cause once you're out of shape, it does take some time, but
Right.
not as much time as that initial time period. But I have a lot of clients that I'll have seen and then graduate from voice modification training that'll come back a year later and be like, I just need like a tune up. And I'll hear things got a little bit maybe darker sounding, a little bit deeper. And then within the first 5-10 minutes, it's back to where they were when they left. You know, they just needed that little jumpstart reminder. Because it's just about the consistency. And yeah, our brains are so strong in what we remember, and our bodies go right back into things. So that's
right. It's a lot about habituation, I would probably think. Would there be then a correlation with time-wise? The longer time you take away from practicing your voice, maybe it's that much more challenging it's going to be to get back into it and to just bring all of that memory back up to the surface?
I think if you do go all the way back to what you were doing previously, yes, I think that amount of time, it would take longer than to relearn what you once learned. But the good thing again is because so much of it is the belief that you can do it. If you've already known you can do it, that belief alone won't be as big of a block for you. And you can make progress much quicker. I swear, it is just changing somebody's mindset from there's no way this will ever happen to me to, oh, actually, I think this can. That it's a beautiful thing to see in somebody, because it's not about the voice at the end of the day. It's just about the person and how beautiful they are, and to see that confidence, it just, everything starts happening for them. Like it's nothing to do with the voice.
I agree.
I got a new job and I got a new this and I found a new lover and I got a new pet pig, you know, like so many weird things happen that are so amazing.
Say pet pig.
Yeah, I have had a client that got a pet pig.
Oh my God.
But you know,
That's great.
all the things start happening and they think it's because they felt confident in their voice, but it's just that overall confidence.
Yeah,
So
I completely agree. I actually plan to do a video about this because I've seen that first and foremost. And I cannot tell people enough how it's not one component. It's not voice, and it's not your face, and it's not the clothing, and it's not your hair. It's actually a combination. You just have to, in my experience at least, you just have to get a little bit, just enough aligned, just enough. It doesn't even have to be perfect.
right.
And feel that confidence, feel that positive attitude, and the way you carry yourself. I've seen people who are not even interested in working their voice. And if you didn't see them, you would probably presume that it was a masculine voice. But they walk into the room and the way they hold themselves and the way they carry themselves, it doesn't even matter. It doesn't matter. All you see is a woman. So I agree with you. I think that confidence and positive attitude can really, I would even say it can probably make or break the whole transition process for people. The question for you, when people are starting out, I bet a lot of people have a very inaccurate, very skewed perception how their voice sounds already. So in other words, you probably get people who think their voice is very masculine, very deep. And, you know, you start talking to them and you realize that, no, your perception of yourself is very skewed. You don't have a very masculine voice. Does that happen a lot?
It does. I mean, most people come in and don't like their voice, because how many people in general like their voice? We hear it so differently than when we hear in a recording. So we don't even hear ourselves the way the world hears us anyways. And so people are already skewed in that way, that when I play back recordings, I'm always like, are you ready? Because this is an important part of the process. But sometimes I wait a little while, because it is hard to hear yourself back. Even when I listen, I'm like, you know, like, who's the 12-year-old that just walked in? Because that's how I hear my voice, you know, and that's fine. And so that is that big barrier in the beginning to get somebody. What I usually say is, because I'll see people cringe sometimes when they're doing the exercises, and I'm like, okay, I'm judging you, so you don't have to. Only one of us can judge you, otherwise it's too much, you know. So that just kind of relaxes people into understanding, you know, it's okay. It's a process, and most people come in not liking their voice or thinking they sound awful, whether they feel they sound overly masculine or overly feminine. I think it's, they just think they sound bad.
Yeah.
You know, and there is no bad. If you have a healthy voice, it's a healthy voice. Let's play with it a little bit. And it's just, it's such a cool process. And it's such a cool process when people change their mind too about what they want. Whereas some people come in and they think they want to sound, you know, super duper feminine and 100% passable, or whatever you want to call it, over the phone. And then I have clients that are like, you know what, that's not me. I love the androgynous sound. It's such a cool sound, you know, and then the target changes, and going from one to the next, it's still a similar process. We take some elements away or lessen some, but it's cool. It's cool to see people change and grow and change their mind with what they want. And that's all okay. And usually clients will be like, is this okay? And I'm like, it's you. Yes, of course. That's fine.
Yeah. How do you find it important to normalize for people what feminine voice just sounds like? Because people have this idea that a feminine voice has to be very soft, very, you know, everybody has their own perception, but usually people forget that there's cis women out there that have very coarse, whispery, androgynous sounding voice, masculine sounding voice. I mean, there's a whole range of it. How often do you find yourself normalizing that for people and helping them realize that women's voice ranges all over the place?
I just actually had this conversation with a client last week where she was like, I need to go higher. I need to sound more female. And I'm like, going higher is not more female. You know, I mean, there's a whole spectrum of how we can sound, and it's fluid and it's ever changing, but there's perceptibly feminine, perceptibly masculine, and then open to all genders. And it's just, society is what puts us into these boxes, but higher does not mean more feminine, or more quote unquote passable, which I hate to use that word, but that is the goal for, I mean, almost all clients, right? Yeah. So we'll use it for the purposes of explaining the goal, but it's just, that's the biggest one, is that people put so much emphasis on pitch. And I used to, you know, go through the pitch graph, and now I kind of go through it really quickly, because I'm like, pitch really doesn't matter as much, if at all. If we get that resonance forward, you can go down pretty low. It's kind of the sound that you want, like you said. And I do have people that like to have a little bit more of that fry in there, and a little bit more of this sound, and a little bit deeper.
I love those voices. I'm such a sucker for those. I'm a sucker for androgynous, borderline masculine, feminine voice that is whispery and coursey. I just love those voices. I have clients that have those voices and they want to go higher, like you say. And to me, it's just like, oh, why would you want to lose that? That sounds so amazing.
Oh,
exactly. It's so sexy and raspy. Just
sultry. I love it.
Yeah, like femme fatale.
It's great. The other thing that I will say having to do with that is what, because you said the breathiness and the softness. I've had a lot of clients that I have to get rid of that because they come like this. And I am just like, you whispering. Are a strong woman. How are you going to order your latte at Starbucks? Nobody's going to hear you. There's a softness in there that we do add by the thinning or the decreasing the mass of the vocal folds to give it a more kind of metallic sound. So you do add like a huh in there. but not like this. This is just not what
You see a lot of women making that mistake, where they assume that's how, it almost makes me think of a timidness, of the feminine timidness, right? Where you sound very timid and very, I don't know, maybe maybe.
Yes.
You find a lot of women tend to do that when they start voice training. Yeah.
Oh, yeah, a lot.
Why
And
do you think?
many, I asked sometimes
Yeah.
why, and I think sometimes it's self-learned behavior. Hearing that there's a softness to it. So adding softness, more of a whisper. But also, more frequently, it's the confidence. It's because if you talk softer, people can't hear those drops.
So it's almost more like a defensive mechanism, and if they can't hear, they can't really perceive either, is it feminine or masculine voice, and I tend to get away with it. I see. Interesting. That's important to know. Yeah, that's unfortunate. I've seen people who started off with voice like that, and I find it personally frustrating because I want people to be visible. I want people to have agency. I want people to be vocal. I want people not to be afraid to speak up. And I think that tends to encourage the opposite of confidence. It's almost as if you're trying to disappear, and we're trying to do the opposite. We're trying to bring you up, build you up, help you evolve into the person you are, and not make you disappear.
Be loud. I want you loud.
Yes, I'm right there with you. So for people who do complete, let's say people work with you and they get to the point where you say, you know what, from my professional point of view, you have achieved desirable voice, you sound incredible. Do people often, and again, for the sake of this video, we're obviously looking for people who wanted the voice modification, who are concerned with passability. I know that it's not for everybody, and we're not trying to push the binary of, sounding like a woman. But the reality is that I agree with you. I would say 98% of trans women that I work with, passability is a huge deal for them. They identify as trans-binary and they want to be seen and they want to sound and be perceived as women because that's how they feel and that's who they are. And that's just reality. So how many people would you say when you tell them that it sounds like you have achieved your desired voice, you sound great, from my professional experience, you have completed the training with me, how many people then say, well, I need to pass what they see a lot of people as a passing test, right? And that's usually the phone test. Is when nobody can see me, but they can only hear me. Is that actually a reasonable, is that even a test? Is it even reasonable? Is it even something to strive for?
Yes. I mean, it's a hard test, especially because the only way you can actually test that is over the phone, right? And other parameters might come into play if the old name is on a hospital document. I mean, so you got to be, again, gentle with yourself and understand that other things might be causing somebody to misgender you in those scenarios. I usually, when it's time to graduate a client from modification, either say, because it'll be conversation and I don't correct anything. And when I do correct things, it's just so picky that nobody else will notice that I get to a point where I'm like, I don't even know. I think it's, and so it is kind of like that individual choosing when they feel done. I'll tell them like, I'm not doing much during sessions. I love seeing you and it's fun and whatever, but I think you might be done as long as you feel good about it. I'm always here. And it usually is when that person is living 100% as themselves, because then you do have those clients that code switch a lot. That adds another element of difficulty with voice. Still doable, but it just is a little harder. And they'll be out and about living their lives and everything's fine and they're not misgendered on the phone, and the phone is a big test. Once that starts happening where the person is gendered appropriately over and over again, that's when they'll believe me that they're done, because I'll be like, you're done, and they'll be like, yeah, no, not yet. So then we kind of spread out the sessions or lessen them to 30 minutes or do check-ins. But I'm only going to be believed if they're, out and about in society, and society is the judge, unfortunately. And fortunately, I mean, it's a really strict, harsh judge. So that's what people are wanting. And so so it's the client basically saying they're done.
So they have to feel internal sense of completeness, which I would assume as a psychologist, I would probably say has a lot to do with confidence and has a lot to do with inner acceptance, and also realization that there's a lot of women that get misgendered on the phone, and there's a lot of, just cis people in general, men and women and otherwise, that get misgendered all the time. So as much as one would want to perceive it as a task, I would probably say that the ultimate test is the level of confidence you feel with yourself, regardless of external validation and the need for that external validation, right? For people working with you, how important are having realistic expectations from the get-go or to the actually to be successful?
I think the expectation that things are going to happen and change quickly is a dangerous expectation. I haven't had super specific expectations. Most of my clients don't come and say, I want to sound like this, which is very helpful. Thank you for that. Usually people just want to, quote unquote, pass as whatever they want to sound like and pass like, and, whatever makes them feel good. So if that's the goal, I think that's a healthy expectation. Mm-hmm. And I think you should have that expectation for yourself if that's what you want for yourself. I think it's an unhealthy expectation to think like, well, it's as good as it's going to get, because that's not the truth. It's just, I learned that in my own life in so many different ways. Once I settle for that and I'm like, well, I have to have good expectations for how fit I can get or how fast I can run. And I beat that every single time, with my own goals, that I'm just kind of like, no, as long as this is what I want in my life, I think that's a expectation. Now, if you say you want to sound like Adele singing or whatever, that might be tricky, but I also think it's a belief thing that you could probably still achieve. I don't know, I'm a dreamer like that though, so I don't believe there are too high of expectations if you believe in yourself, but that is the key.
Yes, I again, we're going back to the confidence, and I think confidence is a huge thing for a lot of people. When it comes to voice training, and I know people are going to be wondering that too, what is approximation? And I know it obviously varies by person, it varies on a lot of other things, but let's say if individual is able to commit several hours a week to practice, right? What would you say is, with that type of commitment, what are we looking for in terms of essentially getting to the finish lines of want to get?
Yeah, that is a huge, that's why I usually say 2 months to 2 years is what I've seen with clients that continue on. Has to do with age, anatomy, physiology. If you're living as yourself full time, if it's back and forth at work and then home life. Again, it comes to confidence and believing in the process. So it's just, it makes it just different for everybody. And then for it to be in your subconscious mind that you don't have to think about it when you're out and about, that takes even longer. And I think a great way is to make a recording of yourself, or even listen to somebody else at nighttime with positive affirmations, just saying, I love my voice, I love myself, and falling asleep to something like that, to really ingrain that into your subconscious mind to kind of help the process speed up, and mix a lot of the psychological aspect with the voice. It's huge. I focus a lot more now, I feel like, on self-concept and building a person up than the actual voice. And it's much quicker.
Yeah, I realized when I asked you that question, I realized immediately when you started answering how similar it is to also the work that I do, helping people to figure out their gender. And especially for those who know their gender and want to transition, people ask me, how long will it take me if my goal is to transition and is to pass? How long will it take? And it's the same thing. It varies. Do you have resources? How confident are you? What is your support system is like? And I've seen people do it in a year and, fully transition. And you've seen those people as well. And we've seen some people who it takes longer. And so I realized, asking you that question, how individualized, highly individualized it is. So yeah, I bet there's no particular time span you can put on it. Now, for a lot of people who are watching this, are in a way also avoiding voice therapy training because there's perception of how expensive it is. There's perception of that it's going to be, just incredibly costly. Does it have to be expensive? And does a person need to have a voice therapist on a weekly basis? What are your thoughts on that?
There are a bunch of people I do not see weekly. I've also decreased to 30-minute sessions to help with that, and it works great. Really, you need somebody to check in with. Some people do it on their own just fine.
And they can do it on their own, right?
They can do it on their own.
So you can totally do your voice training by yourself, maybe through your own personal attempt. Maybe we know there's a lot of YouTubers who offer techniques and things like that. So it is fine to do it by yourself. And is it safe to do it by yourself? Can you actually damage your voice doing it by yourself? Because I hear that that's one of the key negatives of doing it by yourself.
You can damage it. You don't want to obviously stay in falsetto and speak like that a lot, or do too gravelly, or, you can, and you can cause some muscle tension issues. But if you're following, there are a lot of great YouTubers out there now that explain it very, very well. I have an app now out there too that kind of explains how to do the different elements in a safe way. But I have seen many people do it on their own, just naturally, not even thinking about it, and just kind of mimicking other people that they hear speaking and playing around with their voice, and it's fine. But yeah, if you are somebody that wants a little bit of help but not a lot, that's great too. Where I'll see people for maybe once a month, once every other week, and then I make them send me recordings throughout the week, so it's not this whole length of time that I just don't take them, just to make sure we're on the right track, because it is muscle memory to be like a little too breathy, a little too high, a little too big, a little too whatever, just based on what their goal is. And so yeah, so it's doable.
But it sounds like what you're saying is that it's totally doable, preferably at least check in. It doesn't have to be weekly, but check in maybe once a month or once every 3 months with a professional, just to make sure whatever you're doing solo. And that's actually what I recommend for people. I say that I get it. It's costly, can be costly for some people, not for others, whatever your financial situation is. If that's the case and you want to do it solo, I always suggest for people, just check in with somebody, have a 30-minute consult, have a 30-minute paid session, make sure that whatever you're doing on your own is all correct, and then go ahead and keep doing it, knowing that you're not damaging anything. So it sounds like that would be a pretty prudent advice.
That is good advice. Either that, or at least seeing an otolaryngologist or an ENT or your nose and throat doctor to get scoped, to make sure everything looks nice and healthy. I mean, you can feel it in your voice if something doesn't feel right. Like, we can feel it in our body. If something hurts, if something sounds strained, if something doesn't feel good, if something's clicking, we really want to take a look at that and make sure that everything's healthy and fine. But it does not need to be an every week thing. It's the same people. Like, again, I look at this as like going to the gym for your voice. Some people, I need somebody chasing after me, or I'm not running. Like, it's just, no, I know how to run, but I'm not doing it unless you're like, you have to, because I'm going to stand here until you do. So there are people like that I see 3 times a week, because they're like, I'm not going to do it on my own. So it comes to that too, like I can run safely on my own, but unless I have, I take a class, I'm not gonna.
Right. I guess it's also whatever you're going to put into it, you're going to get out of it. So if you actually genuinely are very disciplined and can do it all by yourself, that's great. The reality is that majority of us are not the disciplined. I'm not the disciplined. A lot of other people aren't. And we need that. We need that kind of professional guiding us and helping us. So I agree. I think it depends on individuals and where they are in terms of being disciplined or not.
Yeah. And I think the other part is it's kind of fun to work with somebody else too, right? You get that witty banter back and forth, and make a new friend, or I don't know. So there's that element, that psychological element too, of just getting to feel good. I think if you're confident in your voice, you're done. Like, that's it. If you love who you are, you love how you sound, you don't care, like, that's great. But if there's a lot of insecurity there, then you're going to want a cheerleader behind you, I think, to help boost you up. So that's a big part of it too. Like, how do you feel about working by yourself? Does it feel lonely? Does it feel scary and like a big thing to navigate on your own? Or are you just kind of like, I'm going to try it for a while. If it doesn't work out, then I'll reach out to somebody.
Yeah, and for a lot of people, in my experience, we as professionals in transgender field become the first people that they come out to, the first people that are actually able to see them, the first people they maybe present to. So, and I've heard that many times about you working with people where people would just tell me that you know, you are so good at seeing people for who they are, that you just automatically will use the right pronouns and you will automatically refer to people in a right way. And I heard how incredible and affirming it is. You know, people will say, oh my God, that was like the first time that somebody actually said it out loud. And I know that we're professionals and people say, well, of course you're supposed to do that. But I think there's also a difference between supposed to do that and doing it in a really genuine and caring manner. And I think that really helps a lot of people, because in the beginning, they lack a lot of support. And they're not, in the beginning also of voice training, they're not out to a lot of people, right? So a lot of people are doing voice training while they're not even maybe on hormones. They start really early, and that's because something they can do in private. Nobody has to know. So there's this incredible need, I think, for people when they start to be seen, to be heard. And I agree, we become cheerleaders. We become those first people that elevate them and hold them up and help them.
Yeah,
Which I think is like the best part of our job, is to,
yeah,
for me personally, I don't know, probably for you too, is to be able to see people evolve and how they get so much happier with every step they take. This is why I always tell people, if you want to transition, don't wait, just go for it and do it, because I just seen how liberated and happy and just joyful people become. Yeah.
life is so short. We got to live it as ourselves. And I learned so much from the people I work with just about that too, where I'm like, all my weird insecurities that I have, and I'm like, get over it already. It's short. Have fun. Be you. Whatever. If people don't like it, they can go away.
Oh, you're very confident. It definitely shows. It definitely shows and definitely shines in you. You're for sure a very confident person. I think that really comes across. Going back to the voice, what are your thoughts on voice surgery? Do you think it's effective? Do you think that's, I know that there's risks, potential risks with doing voice surgery. Is it something even worthwhile for some people trying? And most importantly, does vocal surgery, in your experience, gives people those automatic results? In other words, is it just surgery? They go in, they get surgery done, and then they get their desired voice and they're finished.
So I'm not against the surgery. You know, anything that can be faster to get somebody where they want to be, I am all for. I would recommend trying voice therapy first. It is a surgery. Your vocal folds are very sensitive, and there are risks with it, which we've heard. I think the surgeries are getting much better over the past couple of years. Than they were initially. So I think before it was like 50% satisfaction rate. I think that's higher now. But really what it's going to help you work on is it's going to change your pitch. Obviously, it's going to raise your pitch and change the resonance maybe a bit as well, but you still want to look into those intonation patterns of speech, the fluency patterns of speech, to really make it sound how I think you're going to want it to sound overall, because that's a behavioral change, not something that can be done through surgery. And I think after somebody gives therapy or modification, whatever you want to call it, actual healthy try, and they're like, I can't, it's not for me, then it is worth looking into. Yeah, and it's your body, it's your life, and people have been very happy with some of the results. I have worked with a few people after having that done. Some are very happy. I've had some that were less happy with a limited range to work with, because it's shortening sometimes depending on the technique they use. But yeah, I think just do your research on that. But I would always recommend trying voice therapy first, seeing if you can do it that way. And a lot of clients like to have that full range still. A lot of them think it's funny to be able to go down super low. I'm training myself to be able to go down really low because it's fun. It's fun to have that contrast and sound, to be able to whip out whatever you want. So there's that you might not want to get rid of, your lower range, but that's really just changing up the pitch a bit. And but definitely look into it, especially if you are a bit older too, in your 70s, and it might be a better option.
Yeah, I agree. I'm the same way. I tell people that if that's something you're able to do, knowing that a lot of insurances don't cover it and something you're really interested in, yeah, it's just like any other things related to transition. So I totally with you on that board. Now, licensed or not licensed, I know that there's starting to become a lot more voice therapists who, what I'm finding is they're not licensed. And when I say licensed, I mean licensed professionals. They don't have a license, holding a license in speech therapy or speech pathology, or what is the right credential? What is it exactly?
Speech pathology.
Speech pathology. And oftentimes I see them being people who are transgenders themselves, who have done their own work, perhaps solo, and they're pretty much using a lot of times the techniques that seem to have worked for them on other individuals. What are your thoughts on that? Is that to be avoided? Is that good? Is it bad? Any ideas?
There are a lot of very brilliant vocal coaches out there that know their stuff, and they're not licensed, and they're probably wonderful and so much fun to work with. I think the most important part is finding somebody you feel comfortable working with. And, you know, there are a lot of speech pathologists that start this work too. Even me as a baby speech pathologist, you know, years ago, how much did I had to grow my skills too when I was licensed. But I think you want somebody that knows a bit of the background, that knows, you know, how to maybe do voice therapy. But again, there are so many vocal coaches that are vocal coaches without their SLP license that are wonderful. So I'm not against somebody finding a vocal coach instead if the price is better, or, you know, their relationship with that person is stronger. I think, again, because self-concept plays such a big role, you need somebody that you relate to, not somebody that you think has a license. Because at the end of the day, like, there have been times when I want to let mine go a little bit, because it doesn't matter in modification. We're modifying the voice, and people are brilliant with their voices that aren't licensed. So that, I think, is a personal decision.
Okay, I like that answer. Now, for people who are, let's say people are dedicated to voice training, right? And by dedication, we mean several hours a week. And they're dedicated, and whether they're working with professional like yourself, or they're working with somebody who is not licensed but does vocal training, or if they're just following their own method through some YouTube resources. What do you think would be a good kind of a Gudge timeline for them to stop and assess, and to actually be able to evaluate if they feel like they're making the right progress? And I think that would be helpful for people to know, because then they can ask themselves whether this person working with me is actually getting me the results I want. So if they're genuinely dedicated, and we're talking about people who are truly dedicated, we're not talking about people who, you know, barely scratching the surface and upset that after 2 months they're nowhere near their voice. So, but if you are genuinely dedicated, what do you think is a good Gudge timeline? A month, 2 months, to kind of stop and assess where you at?
I think that's a hard question, because it's kind of a hierarchy that you're working with. Like, are you happy with how you sound when you say words? Are you happy with how you sound when you say phrases, then sentences? So it kind of works its way up a little bit.
Mm-hmm.
I think you need to, that's why I say I like somebody to hear a word or a phrase they like within the first couple of sessions. And if you can't get yourself there within about a month to hear something that's like, okay, then maybe look at how you're practicing or what you're doing, because you should on book, not in conversation. Conversation is a whole nother ball game. But when you have paper in front of you that you're just reading multisyllabic words, if you can't hear something that you're like, all right, that's kind of where in the realm of what I want, pretty early on, then look at how you're doing it. Because I see people achieve that in the first day. So you wanna, that's when I would kind of be like, okay, wait, what's happening?
Mm-hmm.
All my words sound the same. And that's why I'm such a big advocate of recording yourself, because also what you can do is, if that's not the case, if you have recordings from 2 months ago and recording from today, you can listen when people are like, I'm not making any progress. I'm like, well, let me go back to, you know, and they're like, no, thank you. Okay, point made. And you can compare on your own to see if you feel like you've progressed towards your goal or not. Again, it's your goal. It's modifying your voice. So do you like how you sound better now in this recording of the same material? Don't be matching your sentences with your words, right? Because There's the hierarchy. But if you can, for the same sentences 2 months ago, if you think you sound better and you like it more now, then that's progress.
Okay. So recording is a huge component of it, which is also very difficult for people to do because it keeps track of something they don't want to keep track of. They already don't want to hear what they sound like on recording, but it sounds like this is the best tool anybody can actually have to gauge where's the where and where they're going, and to be actually be able to hear any difference.
Yeah.
Yeah.
You have to hear yourself. Gotta listen. It's so hard. I know. And you don't have to do it right away, but just make the recordings. Don't listen to them. Make the recordings, build yourself up. You got to have that self-confidence. Do not listen to your early on recordings if you're not in a positive space in your heart and in your head. Do not.
Yeah.
You don't need that extra drama in your life, but do the recording. Do yourself a favor for in a year when you're in a better space so you can go back and listen.
I think it's important to have that baseline.
Oh.
It's analogous to trying to lose weight. You got to get yourself on a scale and see what you, yeah, a Grinch too, what your weight is. But, and I mean, scale is not necessity. You can also gauge by how clothing fit, but something has to be a baseline, right? You got to have some kind of established baseline. And I think the goal is to remember that you are doing incremental steps to get to where you want to get, and you will get to where you want to get because things accumulate, and then suddenly you see the results, suddenly you hear the results, and you got to trust the process, right? But you got to start somewhere. And I agree. I think recording is really important. So going back to you, I also noticed on your Instagram, you're like an amazing, I don't even know what to call it, gymnast, some kind of doing some kind of swirls in a space.
In the sky.
Whatever you're doing looks terrifying. I'm afraid of heights. So whatever you're doing gives me vertigo. What is exactly you doing? What is that? Is that a side hobby, passion? What is it? Tell me.
It's aerial. It's called Lyra, and I love heights.
Aerial?
Aerial.
That's what it's called, aerial. And what is aerial?
It's anything in the air. So some people do like hammock yoga or silks where they like twist themselves in silks. That gets very confusing for me. I like the hoop or a lyra. I love heights. I love climbing. I've always wanted to be good at like gymnastics. So I started this like 2 years ago, I think, because I saw my friend post a video of herself on Instagram doing it. And I'm like, what is this?
I did not have this reaction when I saw you Instagram. Let me tell you, I had the opposite reaction. I thought, is she nuts? She has nothing better to do. But I can see how you're talking right now. It lights you up. So it's basically being up in the air, suspended up in the air with a harness on and safety net. No harness.
No, it's like a bath mat underneath it. But it's great because like for me, that's my therapy, you know, because when you're up there and you're hanging on with a fingernail, you can't be like, why didn't they call me? Like, no, you have to focus on the limb that's attached because so it's just such like a resistance letting go area for me. I don't know. It's so fun.
And you feel comfortable and not afraid.
Oh no, I'm terrified sometimes.
Okay. Yeah, I was wondering when I looked at your Instagram, I was wondering how that probably helps you to, and I know it's different. And obviously for you and I being cis people, I feel like we take our gender for granted because we don't even think about it. It's just there, right? So to say that we understand what trans people go through would be really reductionistic because clearly we don't. We can attempt to understand, but we can never fully understand because we're not struggling with the same issues. Nonetheless, I thought that you confronting something that oftentimes is scary and terrifying and doing it anyway is probably still applicable and helpful in understanding how they're also confronting something that is scary and terrifying initially, right? Do you ever bring up your personal aerial acrobatics and share that with people? Do you find that helpful?
I bring up a lot of personal during our conversation. It's all talking. So yeah, that is it is in that way similar to just facing your fears. And there's sometimes I'm like, I'm just gonna do it, where it's terrifying, but it's letting go. It's trusting yourself. Like I never thought I would be able to do that stuff. And it took me years of building myself up. And that's why I know how important just loving yourself is, because I was somebody that didn't, like most people a lot of times on their journey through this life. And once I started believing in myself, the stronger I got, the better I got. I'm still a beginner, but this is something I just started doing, and I surprised myself. And so it's very similar in that way, that you'll surprise yourself once you believe in yourself, how many things change for you the second you just know you're worth it. And
Yeah, I like to remind people that the best antidote to fear is action. Just
Mhm.
action. Just take the action,
Yeah.
do it. It feels scary, the fear goes away. And I think that's very applicable to voice training. Now, last question that I have for you today is, now you've been doing voice therapy for trans people and being a founder of Pride Voice Therapy for how long now?
So I've been doing the modification for I think 7 years now, specializing in it, and then Pride, I think it's been 5 years.
So a long time, right? So we're talking about 12 years altogether.
No, 7 years altogether.
7 years altogether.
Yeah.
So working over 7 years, I bet you met a lot of gender diverse people. In what way for you personally, as a cis woman, in what way has working with individuals has changed, not changed, or informed your own personal visual lens through which you see the world today?
Oh, it's changed everything about me. It is what has given me so much confidence, because I have to be somebody else's cheerleader. And at the end of the day, they are mine. That's why these bonds form, and I get so close with so many people, is because I feel so cared about by my clients. And I'm like, okay, if you care about me, I've had to learn how to care about me too, just like I'm trying to teach you to care about you. And that, it's just everything. It's changed who I am completely. I just see the world as a much more loving place, a much more open place, a much more accepting place. We're making moves, we're trying. And yeah, it's made me a much better person.
That's beautiful. It's sad how you mirror. It sounds like there's a mirroring effect happening where you're helping somebody and they're also helping you.
Yeah.
And so by helping somebody and having somebody help you, you learn how to take care of yourself in a different way. Yeah, I like that. Thank you so much. Well, thank you so very much for sharing and coming on my interviews. I've known Eryn for a long time. Eryn is, as a lot of people watching it who work with me know, you are in my network of people I refer to. You're one of the voice therapists I refer to. And just, for the record, people often know this about me, is that I don't refer to anybody unless they have a good track record and I hear actually people themselves tell me that they've seen results and they feel great. So I don't do this type of, we got a network because we're all professional type of deal. It's not genuine for me. So with you in particular, I heard and I've seen firsthand so many people get results quickly, get to the progress. People love working with you. They love that you're personable, that you do bring element of this intimate things about yourself. You're not afraid to share. You're not afraid to speak about yourself. And people bond with you in ways that they don't bond with a lot of other people. And I bet you probably maintain friendships with a lot of people you worked with. And I think that's such an important component of what we do, is the relational piece, right? It's kind of blurring that line of just a professional and being more, obviously you can be more relational than I can be, giving my licensing rules and all this stuff, but nonetheless, this relation and being more personable as people we work with. And I appreciate that about you so very much. So grateful for what you do. Please don't ever stop doing what you do. Please don't ever stop doing what you do. Keep doing what you do, because you're clearly very, very good at it. Yeah. Do you feel like it's your calling?
What?
Do you feel like it's your calling?
It's definitely one of them. Definitely a big one of them. But right back at you. The things I hear about you are incredible. So
good. Thank you. Well, thank you so very much. Enjoy this very, very much. I know this is going to be very helpful to the viewers. So I appreciate that, Eryn. If anybody wants to learn more about Eryn, I know that you are able to work with people across different states, across different lines. I'm going to put all of your information down below the video for people to catch on. So if anybody wants to work with Eryn, I highly recommend Eryn. Give it a try. And even if you're working by yourself and getting great results, just check in with somebody. It wouldn't hurt. So thank you very, very much.
Thank you so much. So fun.
I know. Great.